All right. Am I back? Can y'all see me?
Yep, I can see you.
Okay. All right. Let's, you see the screen?
Yes, you're good.
Okay, good. So again, what I mean by this last line is these questions are not intended to be tricky. They're not intended to trip you up. They're not intended to require, you know, any like advanced trivial medical knowledge. These are basic questions that, frankly, if you guys are struggling with them, then there clearly are some knowledge gaps there that we need to address. So I don't want y'all to be afraid of these. I truly feel that you know, every APP that I've worked with will do fine on these questions. Okay, so let's talk. See if I can go to my. All right, so let's talk about the logistics. So at the beginning of each month, you guys will take the 10-question pretest, okay? So the scores on the pretest, they don't matter whatsoever. You get credit just for taking the pretest. We want you to take the pretest for a couple of reasons. One, you can kind of use it as a study guide to maybe highlight some areas you need to focus on. But two, it also gives us a baseline to measure our success. And so ideally, you know, you're going to be scoring higher on the post-test after you've gone through some of the curriculum. You guys will receive detailed answer explanations as soon as you take the pretest, okay? So again, they don't, the score doesn't count. You take them, you get the answer explanations. You can use that to study, but it also gives us a metric to measure against. And then after you kind of go through the required amount of activities that we talked about, you'll take the 10-question post-test. So there is a passing score for the post-test, and right now we've set that at 70%, okay? If you guys score less than a 70%, then you've got to go back and review some additional content and then retake the same test until you achieve a passing score. And then your answer explanations for the post-test will only be made available after you achieve a passing score. To give you some more context, you know, if our attendings were to take these tests, I would expect them to score 90 to 100% on each of them. So again, 70% is what we consider a fair score. These are just a couple of examples of the questions, just to give you guys an idea. This is from the infectious disease module. Number 3 there, it basically asks you, how do you treat the first episode of C. diff? Okay, and then the next question would ask you about, you know, IV drug user with endocarditis, what valve would you expect to be infected and what bacteria may be responsible? So again, they're straightforward. They're what I would consider to be things that you guys should know, and what I would consider you guys to know. Again, in my experience with working with most of you guys, I don't think these questions will be a problem. And this is just a screenshot of some of the explanations that you would get after you take the quizzes. So each explanation has a list of all the concepts that we have tested you on. And as you can see, this from the pulmonary module, as you can see, this is all, you know, routine hospital medicine type content. And then after that, we have detailed explanations for each question that not only explains why the question is, or why the answer choice is right, but it kind of goes into detail as to why the other ones may be incorrect. In terms of self-assessment, at the beginning of this curriculum, so sometime next month, you guys will take a self-assessment, and then you will do another one at the end of the curriculum. So this is just a single question survey that we'll send to everybody, and it basically asks you, how do you think you're doing? And it's a 5-point scale that says, you know, when it comes to functioning as a APP, you know, I either require full physician review to formulate plans to care for my patient, all the way to the 5th option, which is I consider myself to be functionally independent. Okay, and so you take that at the beginning and then take it at the end. and obviously we're hoping to see some improvement. Okay. Similarly, we're going to have all the attendings fill out the same question for the APPs. So they'll do this at the beginning and they'll do this at the end, and it asks basically the same question. You know, when it comes to functioning as an APP, this APP performs, you know, at these levels. Okay. And so this is important for feedback, but it's also important, as I mentioned with the quizzes, because it allows us to ensure what we're doing is actually working. And if it's not working, we need to do something different. I wanted to take a minute to talk about CME credit. So one of the big things that we struggled with at the beginning was, you guys are professionals, you're not students. And so if we're going to be requiring that you do some of this work, you need to get credit for it. And to that end, we have designed it so you can earn actual CME credit by going through this curriculum. So you can earn an hour of CME credit for the Chalk Talk, and you can also earn an hour of CME credit for attending the noon report session. So if you went to both of those every month, that would give you a total of 24 CME credit hours a year, which is more than enough for the 25 credit hours you need every 2 years. So we wanted that to be an aspect of this. And if needed, you can also earn CME credit with some of the outside resources that we've selected, but we can talk about that offline. But essentially, if you go to just one of these formal lectures a month over a 2-year period, you're going to get all the CME credit that's required by your licensing boards without having to do anything extra. Okay. Obviously, you're welcome to do extra stuff, but we wanted to make sure you guys could get credit. So that's kind of the program in a nutshell. I want to do a review example again to kind of bring it all together to make sure everything's clear. So come August 2020, this program will be launched. This August will be dedicated to cardiology. At the beginning of the month, you're going to take your 10-question pretest. Again, the score does not matter, and you'll have the answer explanations immediately available. And then after you take the pretest, using the master content guide, you'll pick out, your 5 credit hours worth of content that you want to work through. And you go through this at your own pace, and you pick out the things that you want to do. There's a fair amount of already pre-selected content that's going to be on the shared drive, but anything new that we add, whether it's the new report or the newsletter that I write that month, it'll all be cardiology based. Okay. And then after you go through all of the content, at the end of the month, you'll take your 10-question post-test that you've got to score 70% on. I forgot to mention these tests are going to be provided on HealthStream. Okay. And then again, we'll go through the 12-month period, and as we move into August of 2021, that's still going to be a cardiology month, and this is probably where we're going to move on into phase 3. But everything that month will still be dedicated to cardiology. We'll have all the content, all the cardiology content available, and any new things that we come up with every year or every month will be subject based. But again, after this initial 12-month period, nothing will be required. There's not a specific amount of content that you have to review, but we still want to kind of continue this ongoing development, ongoing educational activities that'll still be subject-based month to month. All right, so what questions do you guys have? That's kind of, I know that's a lot of information, but what questions do you guys have for me? Anything that wasn't clear, or any concerns that you guys want to raise right now?
You said all the quizzes will be administered via HealthStream?
Yep, and you can take those at your own discretion. Obviously, we want you to go through the content in between the pre and the post test, but if you wanted to take the pre-test on August 1st, spend a Saturday going through the content, take your post-test on August 3rd or whatever, that's fine. But yeah, it'll all be available on HealthStream.
Hey, Tim, we just got to make sure that we have it completed by that month, right? By the end of that month.
That's right. Yep. As long as you've gone through everything by the end of the month, that's and I'll be able to log in as like an administrator on HealthStream and see the progress and who hasn't completed and who has. But yeah, you've got the whole month to kind of go through it at your own pace.
Hey, Tim, Bev had a question. She said, who does the physician evaluation?
So I'm going to spend some time thinking about that over the next week, what I am thinking about doing. And I wanted to talk to Courtney and a few others about this, but I think that either I'm going to ask each attending to tell me, who are the 5 APPs you've worked with the most, or send out a survey and allow them to select the APPs that they worked with the most. So I don't want any attending who hasn't worked with an APP to fill out an evaluation. That's worthless. So at some way, either through a survey or just by them voluntarily telling me who they worked with and feel comfortable providing an evaluation on, we'll go through that somehow, and then we'll send out evaluations to the attending just based off of the APPs they've worked with.
Would you include our collaborative physician?
So we have talked about that in the past. The biggest issue there is that a lot of APPs don't work with their collaborative physician very closely, or really at all. So I think if you're an APP that does work with your collaborative physician kind of closely, their input is really valuable. But just given the size of our service, that's not the case for everybody. So to answer that question directly, for some APPs, it'll involve your collaborative physician, others it probably won't.
Tim, Ginger asked, will the noon talk be available for nights?
So, great question. This is the first time that I have been the host of Zoom, and I think that I have recorded this this presentation, assuming that works. I think it should. My plan is to record the noon reports, and so that they'll be available to everybody, even if you can't attend, whether you're working nights or you're busy on service. If the Zoom links end up being an issue, or if we eventually get back to the point where we're having in-person noon reports, I do want to have them recorded some way, somehow. I haven't quite figured out from a technology standpoint the best way to do that, but yes, I want, for me personally, when I was going through residency, these small group sessions was really where I learned the most, I felt like. And so I want to apply that to you guys, and I think that they're going to be high yield. And so I want to make sure they're available to everybody, even if you can't make them.
Hey, Tim, you might have already answered this, and I apologize if you did. How many physicians would be evaluating us? I know, the physicians would pick up to 5 APPs, but would it be one physician per APP?
It kind of depends. And what I mean by that is just based off how the schedule is done, I feel like, at least personally, there's a handful of APPs that I work with a lot, and then there's a lot of APPs that I never work with. I don't know if that's the case with every attending. I don't have a great feel for how everybody's schedule looks. But to answer that question, I think it might vary. I think what's most important is ensuring that the attendings that evaluate you have spent a lot of time with you. And so if you're an APP that just have happened to have worked with 10 different attendings in some close capacity, then you may have several attendings evaluate you. On the other hand, if your schedule fell in a way that you didn't work with as many, then you'll have fewer. So like I said, I haven't quite nailed down the logistics of that, but I think it's probably going to vary. And again, we're using that for two for two reasons. One, to help use that as a feedback tool for you guys, but also to show improvement after we go through this program. And so we'll end up taking an average, whether it's 5 attendings or 10. We want to see a jump in the average score that you guys are given by the attendings.
Okay, thanks. That
And
makes
this
sense.
is not, these evaluate, I'm sorry, what would you say, Lakeisha?
Oh, I just said that. Thank you. That makes sense.
Yeah. So, and I want to make a point to say that these evaluations nor these quizzes are designed to be punitive. Okay. It's really about making you guys better and allowing you to, not maybe better was the wrong word, allowing you to develop and grow as a practitioner. And also, it is important when we're doing a project this big, we do need to try to prove that what we're doing is working. Because again, if we go through this and we're not seeing improvement in the evaluations, whether they're self-evaluations or faculty evaluations, then we haven't accomplished our goal and we haven't implemented the things that we need to. So it's kind of twofold. We want to provide the feedback, but we also want to show the steps that we're taking is actually making a difference.
Kansas asked if they'll be told the results of the surveys.
Yes. I want this to be totally transparent. Again, we haven't quite ironed out all the kinks, but I think that, I want all of these evaluations to be totally transparent. Now, we may need to figure out a way, we may end up deciding to make it like totally anonymous feedback. I'm not exactly sure about that. But either way, I think it's important for you guys to know the results, because that's what is going to allow you to grow. If you don't know that you have gaps, then what's the point of doing all this? Other questions? Other thoughts?
I'm
You
excited.
guys all hate me now for doing this. Yeah, no, I really think this is going to be good. I know it's easy for me to say on my end, but this is something that we've worked really, really hard on, and I think this is going to allow you guys to really be the best that you guys can be. And so I think, as somebody who really has a passion for education and APP development, I think that this really is going to be good. And I think it's going to make us all better.
I know if it's anything close to the orientation binder, then it's going to be great.
Good.
Yeah, I was going to say, I'm getting texts from anonymous people saying they're very excited. And then Bev said she's excited and she thanks you for your hard work. And I agree. I know how hard you've worked on this.
I agree too, Tim. And I really think from an education standpoint, this is going to be beneficial for us all.
I think
Yeah.
you picked the right person for our education director.
Well, thank you. This has forced me to learn a lot too. The way that I picked some of the topics that we focused on with the weekly digest and the newsletters that we do every month, those are topics that I'm weak into and things that I need to know. And so we all have room to learn, and as healthcare providers, if you're not willing to continue to learn, you're doing your patients a disservice. And so I think this is good. If you guys have any other questions or any feedback, any concerns, any hatefully worded emails, please send them my way. Like I said, I really want this to be an open dialogue and something that benefits you guys. You know, this is not for me, not for anybody else. It's for you to be the best that you can be. And so if you feel like there are gaps in the program or big deficiencies, I really genuinely want to know, and I always want you guys to feel comfortable reaching out to me with any concern about this.
Tim, can you see the chat?
No, maybe I'm
You're
still
getting
sharing
lots
my
of
screen.
things. You're getting lots of thanks and kudos.
Good. All right. There's nothing else. I guess we're done. Again, like I said, y'all, please reach out to me. I'm gonna check on the recording of this once we're finished. But if there's anybody that you know that missed this that is interested, let me know. And I'm gonna try to send out the link to this program tomorrow, assuming things recorded appropriately. But if we need to meet again, have another town hall next month, I'm happy to do that. Okay.
Thank you.
Thanks.
Bye.
Looking
All right.
forward to it.
Yeah, have a good
Bye.
night. See y'all later.
Thank you,
Bye-bye.
Tim.
You're welcome.